Is your child feeling unwell with a sore throat, cough or cold? You may think an antibiotic may help. However, these symptoms are common in the winter and are usually caused by viruses, not bacteria. Antibiotics only work on bacteria, and using them when they're not needed can actually do more harm than good. Let's explore why and see how using them wisely helps protect our health. Viruses are tiny germs that invade the body's cells, causing respiratory illness like colds, coughs, flu, and sore throats that clear themselves over time. Bacteria are living organisms that grow and multiply. Many bacteria are harmless, or even helpful, but some can cause infections, and that's when antibiotics are used. Taking antibiotics unnecessarily can cause good bacteria to adapt and develop resistance. This resistance can spread harmful bacteria, including ones that might cause serious infections and a dangerous condition called sepsis later on. Sepsis occurs when the body produces an out-of-control response to an infection, which can cause organ damage and death. Over time, the growing resistance, a problem known as antimicrobial resistance, makes infections and sepsis harder to treat. These tougher, drug-resistant bacteria, or superbugs, pose a serious threat to future health. Also, did you know, in the first few years of your child's life, unnecessary use of antibiotics can upset the natural balance of good bacteria in their developing tummy, increasing the risk of allergies, infections, asthma, autoimmune diseases, and possibly weight gain. That's why it's important to only use antibiotics when they're truly needed. So when your child has cold or flu symptoms, don't look for an antibiotic. Follow these tips to help them feel better. Encourage rest, as this supports your child's immune system. Keep them hydrated by offering plenty of fluids and feeding breastfed babies more often. Ask your pharmacist to recommend suitable remedies for fever, pain, and dehydration. Relieve sore throats in children over 1 year of age with honey and warm drinks. This wouldn't be suitable for children under 1. Ease blocked noses with saline drops or spray. Baby vapor rubs help soothe congestion and improve sleep. During flu season, avail of the needle-free nasal flu vaccine spray. Always check the dosing recommendations based on age and ensure the products are in date. To avoid spreading the virus, encourage your child to sneeze or cough into a tissue or their upper sleeve. Teach them to clean their hands regularly with soap and water or hand sanitizer. Most viral illnesses will get better on their own. Cold symptoms usually clear within 2 weeks, and a cough can last up to 3. If your child's symptoms aren't improving or are getting worse, contact your GP. They'll examine your child, assess their symptoms, and decide whether treatment is needed. If your GP prescribes an antibiotic, follow the instructions carefully and ensure your child finishes the full course, even if they start feeling better. Stopping too soon can leave some bacteria behind, giving them a chance to survive, adapt, and become resistant. So remember, using antibiotics wisely will help ensure they work when we really need them, now and for future generations.